Roper St. Francis Healthcare's House Calls TV.
The symptoms of ovarian cancer are usually subtle. That's why it's so important that women know what they're looking for. Dr. Scott Jennings explains.
Ovarian cancer is it's a difficult disease to find with test or testing that's available today. So realistically, once again, the only real thing to do is just careful exams on an annual basis or even more frequently if problems develop. The biggest issue about ovary cancer is it's a subtle but very persistent change, and most women would describe this disease as a disease of pressure, fullness, or really just a sensation, something not being clearly correct.
Doctors are more optimistic about treating ovarian cancer today than they were 5 or 6 years ago.
Most ovarian cancers will unfortunately have spread to some extent by the time surgery is undertaken. But even then, the surgery is remarkably effective at usually reducing the bulk of disease, getting rid of the bulk of the tumor, so you can really get down to a point where other treatments can be so much more effective. Chemotherapy is a real mainstay of the treatment of this disease.
Those most at risk include breast cancer survivors and people with a family history. For more information, call 402-CARE. For House Calls TV, I'm Merritt Dempsey.
Roper St. Francis Healthcare's House Calls TV.